Good morning, everybody, and thank you so much for coming to the first session of the In Conversation Zone. And I hope you're all ready for a fascinating, I think, next half hour. Let me introduce you to my guests, Tinuke Awe and Clo Abi, who are both co-founders of 5 Times More. Now, if you haven't heard of this organization, I suggest you look at them up because they are fascinating. The work they're doing is fascinating. What they are trying to change is so needed and much neglected, as they discovered when they were getting together. And we're going to talk a bit more about that. But I want to tell you, first of all, 5 Times More is a grassroots organization committed to changing and highlighting black maternal health outcomes in the UK. Now, it was started in 2019 when they came together with, they say, the dream of improving maternal mortality rates and health outcomes. And the reason that they needed to do that is in the title, 5 times more women are more likely to die, black women are more likely to die in pregnancy and childbirth. Now, that statistic has changed slightly, but when I was reading the background to this, and I have to say, as the health editor at Channel 4 News, we've actually done stories with them, and that statistic is not changing fast enough, and there aren't enough people in this space doing this work. So we are very privileged to have them here today. Just let me come first. Tell me why, how this happened.
How we started 5 Times More. Yes, so Tinuke, who had a traumatic experience giving birth to her first son in 2017. So when the results came out in 2018, that black women were 4 times more likely to die in pregnancy, childbirth, and then 6 weeks after. I think we need to understand that it's the 6 weeks after that women are more likely to die. It's not during pregnancy, it's not childbirth, it's the after bit. And she said that she had a organization called Mums and Tea that she started, and heard that loads of the women that she was supporting and communicating with also had a bad experience. So she wanted to do something about it. She contacted me on Instagram, stalked me, but I'm going to say contacted me on Instagram. At the time, I worked in perinatal mental health, supporting women during their pregnancy, talking about all things to do with mental health from my own experience of giving birth to my first son. And we were supposed to have a one-off event. That was it. We wanted to raise awareness, one-off event. And then we ended up building 5 Times More. It just happened, which was a good thing because it's needed, but that wasn't our intention. So we started 5 Times More, and from then it's been 5 years this year, actually, and it's been amazing. I don't know if you want to add on a little bit more.
You've literally said it all.
Oh, well, that's that session then.
We'll all go home.
Yeah. I want to talk to you. So the number has improved ever so slightly. And what would you put this down to? Is it your campaigning? Is it something in the air? Is it people suddenly taking more notice of this issue?
Okay, so not to blow our own horns, but there is a correlation between when we started and the stats actually going down. So the tricky thing is with Embrace, who we take our data from, they take the national data of mortality rates in the UK. So their reports are a few years behind. So we've only just been able to realize there's a correlation between 2020 and when we first actually took off. One thing to note about the stats, like, I'm not a maths person at all. It was my worst GCSE, guys. But with the statistics, even though statistically it's gone down, but the ratio between black women dying and white women dying, overall the state of maternity care is terrible, and overall actually there's more mortality. So it's a bittersweet, kind of statistic, because yes, it's gone down since we've started, but actually overall things are just not looking great.
I mean, we know that there have been a lot of problems with maternity services. We know of all the scandals. Do you think sometimes your story, what you're trying to do, what you're trying to influence, gets subsumed into the overarching problems with maternity services?
Yes, I definitely think so. I think it's easy to think of maternity and then it's, oh, well, the black women as well. Without actually realizing things are worse for us at all levels in maternity and outside of maternity as well. Like black women and the statistics that follow them, unfortunately, are not great. So it's not just black women dying, it's miscarriage, it's stillbirth, so many other things to do with maternity, and that can get swept up with an overarching, well, maternity is bad in general, and then it just kind of, yeah, goes in there.
So give me some examples, because I was, when we did a piece for Channel 4 News, I talked to one mother who said the midwife just would not recognise her baby had jaundice, and this was an issue with the midwife not understanding what jaundice looks like on a black baby, but were way worse examples than that. Can you give me some examples?
I'm trying to think of a good one. I think I'll talk about Shamika. Shamika, she was a young mum. She had her baby at the age of 17. She went home. She was sweating. Every time she woke up, the bed was wet. She went to the hospital. They said, you're fine. You know, your first-time mum is okay. You're breastfeeding. It's the milk. Went home. Same thing happened again. Called in the ambulance. You're fine, it's nothing, you're first-time mum, you're overreacting. And also, as first-time mum, you don't actually know what to expect and what not to expect. So you kind of go off what the health professional says. The third time she went in, a nurse actually, because she went in A&E, a nurse looked at her and said, you need to go into surgery straight away. She had retained placenta. And now she's still suffering. I think she's 23 now, she must be. And she's chronically ill. She's always in and out of hospital. That's just because she wasn't listened to. And I think sometimes when we go into hospitals and we don't actually know what's wrong with us and we go in hoping that they will know, they kind of brush us off. It's happened too many times. Another experience, which is not maternity related, but is healthcare related, your son.
Right, yeah. I was going to say, actually, sometimes with the example you gave of jaundice, sometimes health professionals don't know what things look like on black skin. So the example outside of maternity that we wanted to give was a couple of years ago, there was an outbreak of hand, foot and mouth at my son's nursery. And we were sent this email and they said, here's what to look out for. I've gone onto the website, NHS website. Sorry, I've got to tell the truth. Went onto the NHS website and it was all images of white children. And I was like, right, okay, how am I supposed to know? If I take this to a health professional, how are they supposed to know? There are literally no images of hand, foot and mouth on dark skin. And I was very angry. And I tweeted the NHS and I was like, what's going on here? How am I supposed to know what's going on? I'm having to look at essentially sources that are not trusted to be able to look at directories of conditions on black skin, because there's nothing on the NHS that's supposed to be for everyone. So if we take the context of, you know, what you said about jaundice, actually what are people learning and how inclusive is that of people with darker skin tones, actually?
I must add, sorry, RHO have looked into it. They've done a few research, so the AppGuard and jaundice actually, so they are actually doing a lot of work around it and trying to change it. Malone as well, he's got a book called Mind the Gap. You see all condition on different skin tones, so darker skin tone, lighter skin tone, and what it will look like. So work is being done, but just not the NHS. It's doing the work, because people outside of it are doing it.
Well, in April 2021, you launched the Black Maternity Experiences Survey, asking black women who'd been pregnant in the last 5 years to tell you about their experiences. And you said within 24 hours of launching, you received over 500 responses. Now, that suggests to me that there was a massive gap, that there were a lot of women out there who had no one to tell their experiences to. What was the value of that survey, apart from that, obviously?
The value of that survey is still to date, that is the largest experiences survey of black women giving birth in the UK. There's been nothing else done on that. And I think that's quite sad given the statistics that we do know. But what we wanted to do was look at what we wanted to do was look at, right, we know what the mortality is, but what about the morbidity? Because we know that for every one woman that passes away, unfortunately, there are 10 women behind her having a really, really bad experience. But actually, sometimes that's not caught anywhere. You can see from our report, Black women are not complaining because of the type of treatment that they've had. So we wanted to really find out what was going on, what's happening deep down underneath those statistics. So yes, within 24 hours of launching, we had 500 respondents, and I can't tell you what that means to us. In the end, we got 1,346, I believe. And it just meant that the people higher up that say, oh, we're looking for Black women to fill out this survey, we're looking for Black women to take part in research, we're looking for this. And they're like, we can't find them anywhere. Well, actually, how are you trying to engage? Because within 24 hours, we got all these Black women that you can't seem to reach. So I think that was really important for us to be able to show them what can be done if Black women are actually at the centre and forefront of their own research.
I also wanted to add, the survey had 220 questions as well, so it was a very, very long survey.
We wanted to know everything.
Everything, literally. We know for next time to do less. But another thing is, you hear a lot, Black women are hard to reach, Black women don't get involved in survey, don't get involved in report, don't do feedback, and Black women are dying because they're from a low economic background. A lot of the women that were part of the survey, I think it was about 70% of them were married, earned over the average wage, and were educated. So when you hear, Black women are single, young mum, not educated, live in poorer, have poorer outcomes, live in poorer, what's the word?
Low socioeconomic status.
That's why I need her. She just knows what I want to say. We want to say that's not true. You're just not trying.
Yeah. You two are a match made in heaven.
Honestly, we are.
Yeah. And that's probably why it works. I want to draw out more about research, because you have talked in your paper, on your website, you're talking about the lack of research, the lack of funding, the lack of grants. Can you talk me through some of that?
Well, actually, even though we do have that accolade of it being the largest experience survey for report for Black women, it was completely unfunded. We literally did it ourselves. We had a whole bunch of amazing volunteers, Black women, Black researchers, Black community groups, who saw our passion and knew that obviously there was a gap, but knew that it was needed. So we're very on board to help us make this happen. But it shouldn't need to be like that. And that's, it's such a shame that we've had to do that. But we had to do it because there was that gap, and we're very passionate about making sure that it's not just an excuse, you can't find Black women. Actually, we're here, and we do want to do the work, and we do want our experiences to be heard. But there is absolutely a lack of funding. We do everything we do on a really tiny shoestring budget with no help. Everyone thinks, oh, 5 times more, you're so big, you're so amazing. Actually, it's just the two of us running it full time, where it shouldn't be. We've got our young kids. My youngest literally just turned 4, so it is quite hard to do the work. But when you're so passionate about something, and obviously with the personal experiences that we've had, we just want to get it done.
Have you tried to get funding?
Permission to be honest?
Yeah, go for it.
It's really difficult trying to secure funding. I think when people, I just don't think Black maternal health is sexy, if I'm honest. It's not sexy, it's not trending, it's not something that garners that much attention. Obviously, we scream and shout about it, we're on the news, we're training health professionals, we're doing what we can do, but actually it's not sexy, and I don't think the powers that be above really wanted to recognize it, to be fair, and just the effect that it has, not just on Black women, just on the community in general, and everyone at large. It has such a knock-on effect, and I just don't think it's taken seriously enough. So no, there is no very, very, very little funding opportunities there.
But when there is funding opportunities, it doesn't come to myself and to Tinuke. And I think it could be because we are grassroots. I think using the word grassroots does a lot of damage to us.
I really want to scrap that word,
It needs to go.
grassroots. It needs to go. It really does. I feel like when you hear grassroots, you just think, oh, it's a small charity. Well, actually, they're doing all the work. And a lot of these bigger organizations can't actually get access to funding without those grassroots organizations helping them. But they don't actually, that money doesn't seem to funnel down at the end of the day. It's just well, we've got these black women,
These grassroots.
these grassroots communities. That's essentially how it works, and it doesn't work.
What do you think? I mean, you talk in this paper too about the lack of funding specifically going to black researchers. Now, we've talked a lot about that in the past in this in conversation zone, and the recognition that there needs to be more funding, better channeled. How can you make the next move? How can you improve those? Help improve those. It's not up to you, by the way. It should be a universal, but to help improve those statistics, if you can't get that research going to black researchers.
I think that's first and foremost, it should go to black researchers. I'll give the example of the getting 500 responses within 24 hours. That's because we have the trust of the community. And people know us, and people know that we're not just here to mess around and just collect data for collecting its sake, or have a report that's going to sit on the shelf collecting dust. They know that we're very serious about what we do. We're very serious about improving things for black women. And actually, that level of representation means a lot, because the type of questions you ask will be different, and the level of engagement will be different, and just that level of understanding will be absolutely different using black researchers. But for some reason, and it's not like they don't exist. Oh, there are black researchers by the truckload that we know, but actually, for some reason, it just doesn't happen.
So, what does need to happen next? I mean, you've talked about more research. You obviously need some more funding. While we are slightly restricted on what we can talk about politically, there will be a new government, whether it's the same government or Labour or whatever next time. When you're standing in front of them, what will you be saying to whoever is in power?
I think, well, I know there needs to be a target to black women dying in pregnancy. There needs to be a target. If it's not black women dying in pregnancy, there needs to be a target of women in general dying in pregnancy. There needs to put a number to it. They have target in babies dying, miscarriages, pregnant women smoking during pregnancy. There's a target for everything, but women in general dying in pregnancy, that's not there. And I think that needs to be there, because we bring life into this world. So why is there no target to ensure that we stay alive?
That's a very, very good one. And obviously, we've all seen, I'll give the example of smoking cessation within, when the NHS want to put a target to something, they will put a target to something, and it will happen, and it'll get the funding it needs, and the PR it needs, and the marketing it needs. It gets everything it needs to be able to make sure that actually does happen, and that change happens. So putting a target, it sounds so simple, but it could make a world of a difference to all the NHS trusts and how that trickles down to the women, the very women, like you said, that are giving birth and trying to just bring life into the world.
We do have time for questions. If anybody here has some questions to ask, there are some microphones. But just while we're waiting, I wanted to ask you, and it's going back a bit on your loathing of the word grassroots, but I want to talk to you about how voluntary organisations can work with the system in partnership with NHS England or with other organisations to make things happen. How do you feel about that?
Voluntary system, they community groups, I'm going to say, they need to use us from the beginning. So from the beginning, from when they have their idea, come and contact us. So a lot of the time we have organisations that have an idea, know what they're going to do, don't have black women, and say 5 times more, we've got this project, do you want to come and work with us? So we say yes, we don't hear from them. And then the bit where they need black women, they're like, oh, can you post this? Is that it? We're just going to post. So they assume if we post it on Instagram, black women are going to connect to them, black women are going to fill out their survey. It doesn't work because they know when we work with an organisation, you know it's all over our Instagram, you know about it. So they need to work with organisation from the get-go. It's not a tick box. It's not a thing where post it. We actually want to be involved. We want to make changes, so we want to be involved from the get-go. Or they assume that we're too busy. They're like, oh, you're too busy, that's why we didn't contact you. No, we'll make time for things that we love and things that we want to change. We'll actually make time. So that's one thing, definitely from the get-go. Co-production, let's do that together.
Yeah, I definitely think true co-production right from the get-go, and not in a tokenistic way as well. Not just, oh, we've got these black women, oh, we've got this grassroots organisation, you know, they can help us get black women. I just think that the grassroots organisations, voluntary sector, they do so much and they're so underrated. And obviously the obvious ones, funding, more of a seat at the table, I think that goes without saying. But just knowing the power that voluntary organisations have in engaging with communities and helping you essentially get the results that you want, is really important to know.
I was going to add, I don't want to sit at a table to be the black voice. I want to sit at a table because you know I can do the work. Because every time we talk, so I'm actually happy that the title doesn't have ethnicity, racism, inequality. Anytime you see someone of colour talking, if the title's got racism, inequality, something along those lines, we can talk about other issues as well. Like, please include us in other issues. Yeah, that's it. I think I'll leave it as that.
I have to say, I was quite shocked when they told me how much funding they do get each year, which is not a lot at all. And I don't know how you're looking so beautiful and suave and elegant because it's on a shoestring. We had a question over here.
Hello. Can you hear me?
Yep.
I'm Alex. I'm an obstetrician in Leeds. I very much enjoyed reading your report. What I did notice, which I know you highlighted yourself, is that it represents a proportion of black society that is highly educated. It was quite London-centric, and certainly there were far fewer voices from the north. And while I enjoyed reading it, it was very uncomfortable reading. It was very helpful reading. I felt like a large proportion of my sort of caseload of patients were not represented by it, because I feel like the problem with sort of the maternal mortality with black women goes very much further beyond skin colour. There's so much intersectionality with other disadvantages in society, and yes, we've got a long way to go with unconscious bias and sadly with overt racism as well. But we often struggle to engage the really minority groups within that. And then you mentioned the possibility of doing another survey and making changes to make it more accessible. And I was wondering how you were going to go about making your next survey more accessible to a wider variety of black women to get that voice heard.
Thank you. One question. Who are the women in your community that you're serving? Some of your patients, who are those?
So I couldn't just describe them in one go, but you know, we have a very diverse area around Leeds. Some very high socioeconomically. We've got a big university, lots of academics, lots of students, but we've also got sort of refugee populations. We've got quite a large Eritrean population, and we have pockets where there are very few English speakers, and you know, that's a huge barrier to accessing surveys and focus groups, and the number of languages spoken makes it, and sometimes the nicheness of some of the languages and dialects makes it very difficult to engage with those populations. I mean, tips, tricks, whatever you were planning on doing is what I'm interested in hearing.
Yes, so our survey was done online. So if digital poverty is an issue, you wouldn't have been able to do our survey. If language was an issue, you wouldn't be able to do a survey. So what we need to do is try to get midwives involved to see how they can possibly do it with the patient or some way around it. We can't do it on paper. It wasn't going to work. There's no way it's going to work. But also, we wanted to make the point that black women are educated, and you hear that a lot. And a lot of the research I've seen, they look at women who are refugees, women who English not their first language. There's loads of funding and loads of work that's trying to go into it. But when you look at women like myself and Tinuke, who both had a good and bad experience. So Tinuke's first experience was bad, but her second experience, she was doing 5 times more, so it was a lot more better. My first experience was brilliant. My second was awful. We understand English. I can read. I've gone to uni. Tinuke's gone to uni. We still have suffered. I have doctors who also have suffered. So the point with our survey, which we were trying to make, is we still suffer even though we are well educated and we are still, what's the word?
Can't help me.
She can't help me there.
Sorry.
She helped me the first time. She can't help me the second one. But yes, we were. Can you not read one?
Telepathic wasn't working.
Yes.
Just to add on to that, I think it's a great question, and it's definitely something we thought about. We wanted to actually go into the community and make sure that those very women that you have described are involved, but funding. It all goes back to the cash, let's be completely honest. We can have all these ideas and want to do all of these things, but if we don't have the money behind it to pay the people to go out into the community and do, then these things actually can't happen. So it is kind of, we've just kind of gone full circle. We know what we definitely need to do to be able to reach all of those women. We have a very vast network across the country of voluntary organizations, charities, people who can actually be out in the community and help us do that, as well as the people, online who can access it via social media and get a really well-rounded, experience survey going. But it's money. I'll be just completely honest. If we don't have that funding, then we can't actually reach those people that we really know need the help.
I want to get in touch with you later as well. So when we do the next survey, you can definitely help us.
Yeah. And if there's anybody here who's got some good ideas for finding some funding, have a quick word with them afterwards, although they do have to get a train.
Yes.
Are there any more questions here? It's quite bad.
Thank you for sharing. It was a very enlightening talk. I just want to know, how can we get involved? Oh,
Who you are?
oh hi. So my name's Kito, and I work for the National Institute of Healthcare and Research. And yes, so we, there's so much available in terms of trying to encourage people to study PhDs, and I could go on and on. But I just want to know, how can we all get involved in supporting your cause?
I feel my work is done.
It'd be great to connect, obviously, with what you do. So it'd be lovely to connect outside of this. But in terms of how people can support, well, there are a few ways. We have a lot of our campaigns. So we have like awareness weeks. We've got a Women's Health Summit coming up as well in September. So with our Women's Health Summit, sorry, cheeky plug here. With our Women's Health Summit, we know that a lot of issues don't just happen on the maternity ward. You got to look at the whole life cycle of a woman, right from when she starts her period and beyond. So we have a Women's Health Summit that we're really looking to work in partnership with other organizations on that as well. So if you are interested in getting involved, please do get in contact with us. And also, like we said, we rely quite heavily on donations. So if you ever do visit the website, don't forget to donate, because it does actually goes very far in helping us spread the word to women. There are so many things that we do to help women in the community access a lot of the resources we have.
The free resources that we have.
Yeah.
And the free app that we have. So we actually have an app for pregnant women to use. We did a soft launch in January, but we're going to launch it again, I think, September.
Yes.
So we have free apps. We have a lot of free things for women on our website.
But again, I think people just think, oh, because, we're black, it should be free. Actually, all of these things cost money to be able to do. So donations really, really help. You might think it's small, but it goes a very long way to helping us help others. So yeah, that's a few ways I can think of how you can get involved. But yeah, definitely get in touch.
Okay, well, I'm going to bring this to Hope so that you can have a quick word if you need to afterwards, before they dash off for their train. I haven't actually ever heard quite so many beg for money or funding in one of these sessions, but actually I think it's perfectly legitimate to ask this because, as I said, I was surprised at how little funding you'll get, considering what a big splash you've made and how much attention you've had in such a short time. So really good luck with the future, and I think it's going to be powerful with you two at the helm. Yeah. But don't get too tired. Yeah.
No, we've got kids. How's that going to happen?
Yeah, exactly. Can you please thank Tinuke and Clo for their time today?
Thank you.